Hello, everyone. Welcome back for another live stream. We're going to be continuing things off with healthcare. I believe that overall speaking, the Canadian healthcare system is better than the US healthcare system. If you disagree with the prompt, or if you have any questions or concerns regarding healthcare, feel free to come on up and join the live and share your reasoning for why you disagree. We're mainly looking for people that disagree with the prompt, as well as people that have any questions or concerns regarding healthcare that would like to come on up and share. I believe that overall, Canada's healthcare system is a better overall healthcare system. I also believe that the US should have some form of universal healthcare. And I agree with the current MAID policy in Canada. We're mainly looking for people that disagree with the prompt or have any questions or concerns regarding either the Canadian healthcare system or the American healthcare system. We're going to be inviting guests up in just a moment that would like to come up and share your reasoning for why you disagree with the prompt. I think that overall, Canada's system is a better healthcare system when you compare it to the US. So we're mainly looking for people that disagree and people that have any questions or concerns regarding healthcare that would like to come up and share. Welcome in, everyone. I will let guests up in just a moment. I also believe that the US should have some form of universal healthcare. I think that Obamacare was a net positive on the US, and we're going to take some debates. So if any of you disagree with the prompt that you would like to come up and share, feel free to do so. We're mainly going to be looking for people that disagree or people that have any questions or concerns regarding healthcare that would like to come up. All right. Just to restate, I think that overall, systemically speaking, the Canadian system is a better overall healthcare system when you compare it to the US. So we're mainly looking for people that disagree or have any questions or concerns regarding healthcare that would like to come on up. Laura, thank you for the follow. Appreciate it. Thank you. Of course. So it seems like you agree, Cindy. You always seem to agree, though. We are going to be looking for people that disagree, though, with the prompt and people that have questions. I'm also live streaming on YouTube as well, so we're multi-streaming for the first time. I disagree, as I'm practicing doctor here in US. Really? So if you would like to come up and share your reasoning why you disagree, feel free to come up and do so. That is up to you, though, if you would like. I do believe that the Canadian system is a systemically better healthcare system overall when you compare it to the US. I think that there's other healthcare systems that are better than Canada and the US, but when you compare the Canadian healthcare system to the American one, I think that there's more advantages to the Canadian system and it's a better healthcare system systemically. I also believe that the US should have some form of universal healthcare as well. And I think that Obamacare was a net positive on the American healthcare system specifically. I have friends there in Canada who are practicing. That's good. 9+ months for a simple MRI. Yeah, especially elective ones can definitely be. It does vary though. Like, I'm not disagreeing with that. Canadian wait times are like systemically longer than they are in the US. 70,000 for resident doctors, by the way. Okay. So what would be like your biggest argument for why you disagree with the statement or the prompt? I lost my leg because my doctor had me wait 6 years to get surgery for my leg. I'm sorry to hear that. Merlin, how's it going? Merlin, I hope you're doing well. We're currently live on YouTube as well as TikTok. So this is the first multi-stream that we're doing. 24,000 people died on waiting lists in 2025, by the way. That is not accurate. It is not true that 24,000 Canadians died due to wait time specifically. There's no current evidence that currently like is accurate that shows that Canadians are systemically dying in large numbers due to wait times. Swells, welcome. How are you guys? All right. Honestly, American healthcare is far better than Canada. Trust me. So debate. This is like I've been debating this topic specifically for about a year now. So if you want to debate, feel free to. Canada healthcare is just SSRIs and hop on MAID. Oh, do you disagree with the MAID policy? Because I agree with the current MAID policy as written. If you disagree with MAID, feel free to come on up and we can debate on MAID. Literally recorded data, yes. From what source are you referencing the 23,000? For a good 5 hours. Wait times are horrible though. Last time I went in, a dude gushing blood from his nose, a good 5 hours. I'm sorry you had to experience that. Yeah, many Canadians do get delayed care. You guys are living in an illusion that you guys have free healthcare. We have universal healthcare. Referring to Canada specifically, just to clarify. Chat LGBT, thank you for the follow. I appreciate that. Thank you. All right. Olive oil, welcome in. Welcome in. All right. 350,000 USA people went bankrupt due to medical bills. 0 in Canada. I'm not going to say 0 in Canada in general, but I will say that, like, in general, that does occur in the US, and like around 60% of all bankruptcies are tied to healthcare, which does include like dental, but dental is still a part of healthcare. Everyone I know that lives in Canada comes to the US for healthcare. Many Canadians do go to the US for healthcare. How could you deny literal published data published even by CTV? Because if you look at CTV News, if you go to that article, you'll see that they got their information from secondstreet.org, which is like a conservative think tank, which is not like a reputable source to be using. And the methodology doesn't accurately display that the cause of death is correlated to what the wait times were. So that's why. And if you say I'm wrong, look at that CTV News article, read it. You guys have to wait for an MRI for weeks and even months here. It's done immediately. Yeah, the US definitely has like shorter wait times than Canadians do. That's a fact. Just tell me you also have private coverage because Universal is no good. That's not why universal healthcare exists. It's because Universal doesn't cover everything, which definitionally it doesn't have to either. Private healthcare in Canada is supplemental. Most of the Canadians don't even have a family doctor. That's not true. 88% of Canadians have a family doctor from the CIHI. Insurance in US is like $800 to $2,500 a month. It can be. All right. I agree with Made. It's cheaper and get people to do it. Okay, I will answer your comments, but please do not spam the chat. I want to make sure I'm able to read people. It's okay. You agree with Made. It's cheaper to get people to do it and then heal them. Well, Made is a part of end of life care specifically. I agree with the current Made policy. If you would like to debate on Made, feel free to come up. It's two-tier. Yes, it is public and private for both countries, Canada and the US. Shorter wait times for specialists in the US. Patients usually see specialists faster. That's completely true. All right. Actually, it's 83%, not 88, still higher than I thought. Well, there was a study that was published on CIHI where they show that around 88%. I can cite my source as well, and I could show you the source on screen. Right now, I'm currently multi-streaming on YouTube, and on my YouTube stream specifically, you actually see the sources and you can see the fact checks. So if you head on over to YouTube and you would like me to show you, I can show you the study there. All right, faster elective surgeries procedures like joint replacements typically scheduled sooner. In the US, that's correct. All right. More provider choice. Patients often pick their doctor or hospital directly. That'd be a hot take. I gotta think what would be my position on that. I think that overall in the US, as much as in some areas you do have more choice, but in others you also don't. Like I see that definitely, even though Americans could pick whatever doctor they would like, we see that they normally pick doctors that are within their own network, that you could argue that they limit your choice on doctors because of whether or not they're in network or not, versus in Canada you don't have that same issue. So like that also would be a counter argument for that, on like how you could have more choice in Canada in terms of what doctor you have, but it does vary a lot heavily on like your province and whether or not you're in like in a rural area or not in the US and Canada. America's obesity problem and drug epidemic. Hold on. Epidemic, ask for universal health care. I think the US definitely should have universal health care. I'm not against that whatsoever. Hey Kev, how's it going? Yeah, we got everything worked out. You clearly do not have experience in the Canadian healthcare system. Well, whether or not I have experience or not with the Canadian system is irrelevant. And yeah. Also, look at my profile photo and TikTok name. More hospitals per capita in many regions. In the U.S., yeah, but they also have ambulance deserts as well. U.S. has the worst cancer care system in the world. Not in every aspect. I believe cancer survival rates the U.S. is slightly better than Canada according to the CDC. Can you debate in French? No. Apologize. I apologize. I cannot speak French. Liberal, I'm gonna ask you to stop spamming the chat. All right, we have a guest. Let's have the first guest come up. Hey, how's it going?
Hey, I'll admit I don't necessarily disagree, but I want to ask you real quick. Do you believe in socialism or more so social democracy?
This debate is not focused on like ideology whatsoever, regardless on whether or not
Okay,
it's considered socialist. I do believe though that the U.S. should have universal health care. If you would like to
okay.
ask me
Yeah,
questions
no,
on
I,
that.
I totally agree on that. I have nothing to debate. I just want to ask that quick
All
question. I don't
right.
know if you were aligned with anything in specific, but have
Mm-hmm.
a good night, man.
Yeah, you too. Take care. Well, that was fast. Canadians don't lose everything they owe just to see a doctor or hospital. That is just, that's true. Yeah, pretty much. Let's see here. I'm trying my best to acknowledge each one of your comments. So feel free to just like take it easy. Allow me to be able to like accurately display. I'm trying my best to read the comments. Canada's better. I broke my shoulder 2 years ago. Waited 10 minutes to get in, and the total cost nil. Yep. Nobody Canadians die in emergency rate rooms. So let me acknowledge a few claims here now that we have 135 people here. I'm not saying that no Canadians die due to wait times. I'm not making that claim. But what I am claiming is that there's no accurate and evidence that shows that there's a systemic like number of Canadians, like in the thousands or 10,000s of Canadians that are dying due to wait times. That is something that is rare and that is not very documented in Canada in general, right? There's plenty of think tanks that do their own like reportings of Canadians dying during wait times, but even those studies themselves, they are not able to actually make a correlation like effect of correlating the cause of death to what they're waiting for. So that's my argument with that. I also believe that the US should 100% have universal health care, some form of it. I think that Obamacare was a net positive for the US, and I agree with the current MAID policy, which is assisted unaliving in Canada. So if you'd like to debate on any of those subjects, feel free to join the Live from the Multi-Guest and give your reasoning for why you disagree. This is my YouTube channel. If you like to watch the live stream on YouTube, I'm currently live on YouTube. And if you watch on YouTube specifically, the live and the debates are being fact checked live that you're able to see in real time the actual stats that I use for during my live streams. So if you would like to see the evidence that I have when it comes to the claims that I make, statistics on whether if it be medical tourism, family doctors, taxes, whatever the case may be, you can see all of that on YouTube if you watch the YouTube streams. So thank you everyone for the support. Thank you for the follow. I appreciate that. So if you guys question my sources, head on over to the YouTube streams and you'll be able to see the sources provided. With that being said, let's have the next guest come up.
Hi.
Hey, how's it going?
Good. What about you?
I'm doing well. Do you disagree with the prompt or have any questions or concerns regarding healthcare?
I would say that I agree that Canada's healthcare is better than the US's, but I'm talking from France, so I mean, ours
Okay.
is better than yours.
Yeah, I agree.
For the moment, because it's starting to change. But my question was, it's purely a question. I'm not interested in having a real debate for now.
That's okay.
I've heard some horrible things about Canada recently, and I think it makes sense because they want to do it in France too, is that you offer assisted suicide to people that cannot afford treatment.
Mm-hmm.
Like it's
Would
being
you like me to
offered.
answer on that?
Sorry?
Can I answer that?
Yes, of course, of course.
Yeah, so MAID is not just for like cheaper care. It's end of life care in Canada, and you must have a serious like incurable illness, disease, or disability specifically, right? Mental illness, there's no one that's like getting it for like mental illnesses until that's excluded until like March 17th, 2027. But as of right now, specifically, right, it's a part of end of life care, right? Like, do you disagree with like that premise of end of life care, of that being like an option that you can make a
No, no.
voluntarily consent to?
I totally understand the fact that if you want to leave life
Hmm.
earlier, you should be able to. Like it's obviously important, but I feel like I'm a communist,
Okay.
so I want to play cards on the table. I don't like
Hmm.
to hide myself, and I believe that of course it should be available to people to live with dignity, leave life, I mean, with dignity. But I feel like in capitalist economies, and especially in liberal democracies like Canada, France, the UK, and any other Western country's economy, um, it's used as a pretext to just get get rid of people for cheap. Because as here in France we have universal healthcare, unconditional. You can have treatment for no price at all, especially except if you have very
Hmm.
rare diseases, and then you're fucked basically. But I think it's a way for the system to change. Like you introduce assisted suicide basically, and then you start to stop uh, giving treatment for free in some certain types of cancers, like certain types of
Well, may
terminal
I say
cancers.
something, if I may?
Sure, sure.
So we're like around, according to Statistics Canada, they show that like around 63% of like all MAID cases are like cancer, terminally ill cancer, and then around like 18% cardiovascular, then 13% like respiratory conditions. Where like I argue that the way that's currently being implemented in Canada are for people that are at like end of life care, where that the quality of life is not going to increase with those individuals, where like I don't think that's unethical for that, given how it's currently like being used now. Based on what I said to you about majority of the cases being like cancer and like cardiovascular and like respiratory conditions, like it doesn't seem like you disagree really with me.
No, no, I totally don't disagree with the principle of it. But
Okay.
however, the question I would have with that is that if you have treatments that exist, like today we have more and more treatments that are being developed. Funnily enough, they start to go in the market once the US has got out of the OMS. But the if the people that are being offered these things, like at the end of the line when their cancer is getting too strong and too horrible to live through, but also I don't know how it works, and you'll probably correct me on this,
Hmm.
but is treatment like for cancer, like how do we say chemotherapy? Is it
Chemo.
free? Chemotherapy, sorry. Is it available
I'm
for
pretty
free?
sure it's universal, yeah. Because it would be
Okay.
deemed like universal in Canada for procedures that are considered to be medically necessary, right? So things like dental and eye care and physiotherapy is not typically universal in Canada, but for things like
Yeah, it's the
cancer
same here.
treatments and stuff like that are typically universal. But prescription medications and stuff like that are not, right? So
Oh,
prescription
that's
meds are
okay.
not.
So basically, you can have chemo, but then maybe the treatment you will have next in the line to make sure like the suffering from chemo is not that strong, it's not
Hmm.
guaranteed. And
Yeah.
so we could argue that if the treatment you need is not available to you in the first place, then of course it's going to be unbearable. And at the end, the only last resort you have is to resort to this. And I don't think it's like it's not an argument against end of life treatment
Hmm.
per se, but it's much more an argument of if you want people to have the choice, then really give them the choice and give them the medication for free in the first place.
Yeah. I hear you.
But I think we agree on this. And I just wanted to make sure. And basically, yeah, I think then it's not a good thing, because if you start to implement the thing, which is good, but for the wrong reasons, then you
Hmm.
shouldn't even
Well, I'm
implement
not
it in the first
arguing
place.
over like whether if it's socialist, communist, or like specific ideology. I'm just simply arguing that I think that made there's a lot of misinformation that people have with made
Of
about like
course.
people with mental health getting it or anyone can get it, right? There's a lot of, or also the fact that like it's being pressured on people, right? That like Canada's forcing made onto people, where there's a lot of misinformation about it with those topics, which like for me personally, that's partly why I kind of include that a part of my healthcare debates, because of the amount of misinformation about that topic. And yeah, I'm not arguing on any ideology. I think that it's being used pretty ethically. I don't think that there's a lot of problems within MAID that a lot of people claim there to be.
I think my argument with that would be that if, like you're not pressuring people to do it, but if you don't give them the alternative for free, then they're kind of forced to do it. But
Mhm.
I understand the reasoning behind it. I understand it, and I'm going to leave right here. I'm going to let you move on to another guest.
Yeah, sounds good.
But
I
I wanted to
appreciate
say
that.
thank you. As a communist myself, I would say that Canada's healthcare is not communist, remotely communist at all. And
All right.
then, if I want to argue, like my idea of a communist healthcare system is that everything is free and everything is available without any paperwork, without any kind of stuff. And of course, that's kind of
All right.
ideological.
I appreciate it. I
But
hope you have a good rest of your day, my friend.
for sure, bye.
All right. Let's have the next guest come up, shall we? Thank you, everyone, by the way, for the follows. We have like 13 followers. I do appreciate you guys. Thank you. Hey, how's it going?
Hi. So
Do you
I
disagree with the prompt or have any like questions or concerns regarding healthcare?
yeah, so I'm a nurse in the Canadian healthcare system.
Okay.
Um and I don't know if you covered this or not. But I do see a lot of people in the comments saying like, they're speaking about ER times and things like that. Um so I just wanted to go over the reason why people are complaining specifically in Ontario about the healthcare system. I don't know if you went over it, but it has more to do with your premier more than it has to do with our federal government, right?
Mhm.
So I think people
Well, do
like
you
Doug
disagree with
Ford,
the prompt specifically?
Canada's healthcare system is better. I think Canada's healthcare system, I would say, because here's the thing, right? I was born and raised in Toronto, but I also live in the States. So I've worked in the healthcare system within the United States and I've worked within Canada.
Okay.
The problem with the states is, um, the healthcare is good. It's just not accessible. That's the problem, right? So
Mhm.
if we're talking about the system in itself, um, it's the way that they have it is you have private hospitals, you have county
Mhm.
hospitals, you have like, so if you go to a private hospital, you're gonna have a different experience with the healthcare system than if you go to like a county hospital, right? Where it will have longer ER wait times and things like that.
Mhm. Do you mind if I say something real quick?
Yeah, go ahead.
So in terms of accessibility, I would actually disagree. I believe that the Canadian healthcare system is systemically more accessible than the US system for a few reasons, right? Because you are correct that part of access is geographic access and comparing like rural versus urban availability between like Canada
Exactly.
and the US. And like I'm not, necessarily disagreeing with you there yet. But I would argue that the biggest barrier that Canadians have when it comes to accessing healthcare isn't geographic access, it's wait times, right? And that's the
Exactly.
biggest barrier for Canadians being able to access healthcare. But so is like the cost of healthcare in the US. And I believe that per capita, there's more Canadians that are actually receiving healthcare and receiving treatment compared to Americans when it comes to like affording healthcare. Now, just so I can acknowledge
100%.
at least your geographic access, like I do understand that people, Canadians in rural areas, how they can lack specialists, family doctors, especially in rural provinces.
That actually wasn't what I was saying. I was talking
Okay.
about accessibility in the sense of a lot of people are not able to go to the hospital in the United States, right?
Hmm.
So that's what I mean by access, not
Yeah.
not the fact that like, because there's people that actively will avoid going to the hospital to avoid bills. There'll be people that have like broken bones and
Hmm.
like won't go because they don't want that bill. So I'm not even comparing it in that sense.
Okay.
I'm saying it I'm saying like Canadians have more access. Um Canadians, I do agree, Canadians have way more access to healthcare. And the healthcare in America, if you go to a private hospital, is if you can access it,
Hmm.
it's good. But in
Yeah.
America, the problem is not everybody can access it. And America does have long wait times in their ERs,
Hmm.
just like Canada does. So I
It's
actually
more
agree that
rare, and especially like in rural areas, like it does occur. And I'm gonna
yeah,
be honest with you, I rarely personally bring up the topic of longer wait times in the US just because I believe that the cost of healthcare plus the 11% uninsured in the US, that there's bigger
100%.
barriers to accessibility than wait
Hmm.
times, because in general, that is something that Canada is worse in the US in, right? So I don't typically disagree with that. Now, one thing I think I should also add is ambulance deserts, right? Where it's Ambulance
Hundred
deserts are when it
percent.
takes an ambulance more than 30 minutes to even reach you, right? Where around 4 to 6 million Americans live in what's considered an ambulance desert, where that's way less common in Canada compared to the US.
100%.
And that I think doesn't get like noticed as much. And Puerto Rican, thank you for the heart, man. I appreciate the gift. Thank you.
Yes, and Chicago is one of like so that's where I live and I work, and
Mhm.
it is like certain parts of the city, even though it's a huge city, just as big as Toronto, there are ambulance deserts. They have like the worst ambulance response time, I think, in the United States. They're currently working on fixing it. So my thing is like I've worked in county hospitals and not I wouldn't okay, I'll say government funded
Mhm.
hospitals that are in the city that was in the city of Chicago, and there's people who waited up to 12 hours to see a doctor. So that's what I'm saying, like there's wait times
Mhm.
because of how the emergency works, right?
Mhm.
So obviously the more severe people are going to be seen, and it's across the board. You're gonna wait if you go to the emergency department. That's just how it is, you know?
Mhm. All right. Well,
Um,
look, I don't mean to be
but yeah.
rude. I do appreciate you
No,
coming
no, it's
up.
fine. I'm gonna let you go. I just wanted to
Yeah,
clear that
I
up
want to look
as,
for people
as
that
a
want to
healthcare
debate,
worker.
but I appreciate you
Oh,
coming up, and I hope you have a
100%.
good rest of your day.
You too. Thank you so much.
All right. Like I said earlier, we're looking for mainly people who either disagree or have any questions or concerns regarding healthcare. I believe that the US should have universal healthcare. I also believe that the Canadian system is obviously better than the US. I believe that Obamacare was a net positive for Americans or for the American healthcare system specifically. River, thank you so much for the follow. Um, and Limo, thank you for the rose. Thank you for the gifts. I appreciate it. Thank you guys. Thank you guys for all the support. I also agree with the current May policy as written as well. So if you'd like to come on up and debate, feel free to debate on those topics specifically. We are looking for people that would like to come on up and share their reasoning behind why they disagree with the prompt. I'll be answering some comments for now while we get some guests to come up. In the USA, if you have your copay, you're screwed. If you have no copay, you're screwed. I hear you. What about the stories of people dying in the emergency rooms waiting for help in Canada? Like systemically speaking, there's not like evidence that suggests that thousands or tens of thousands or Canadians are dying each year due to wait time specifically. Now, without any evidence, behind it, I think that there's at least one person that does, but there's not any systemic number and evidence that shows that that is something that occurs commonly in Canada. And if you'd like to debate on that specifically, feel free to come on up if you believe that there is evidence and you have evidence that shows that Canadians are dying due to wait times. If you have that evidence, feel free to come up. Roddam, thank you for the follow. I appreciate that. Thank you. Is your healthcare system like the UK? I would say no. I don't know a lot about the UK, but I know that the UK has socialized medicine where Canada doesn't. So I would say that Canada is very different in terms of its healthcare delivery system compared to the UK. For those reasons, TB123, thank you for the follow. Appreciate it. Canada is better than the US in every sense of the word. I disagree with that. I think that in terms of quality of care, like R&D, innovation, and world-class hospitals, the US is systemically better than Canada. Because quality of care, that is something that the US is typically better than Canada. Even though Canada is better in certain areas of quality of care, whether if that be like patient satisfaction rates, malpractice, right? And in those areas. But overall, the US is better in those areas. We live longer in Canada, so American healthcare sucks the big one. Yeah, the average Canadian lives around 5 years longer, according to the OECD as well as the CDC. When you address wait times, you should do it a way that hold on. When you address wait times, you should do in a way that benefits everyone, not just those who can afford. Yeah, I say that overall, it's not just about wait time specifically, it's about access, right? How easy is it for the average Canadian versus the average American to access healthcare? Wait times is a barrier of that, but so is affording healthcare in the US. I'm simply arguing that systemically, more Canadians are actually accessing treatment and receiving healthcare than Americans are. Let's have a guest come up.
Hello.
Hey, how's it going? Do you disagree with the prompt or have any questions or concerns regarding healthcare?
Oh, I actually live in Nova Scotia.
I'm sorry,
So
but it's hard to hear
my
you.
just 1 second, man.
There's a little bit better.
Yeah. So
Northern
we
guy, thank you for the follow.
I live in the Maritimes, specifically in Nova Scotia.
Okay.
So my premier is in the process of building a brand new hospital.
I mean,
And
hospitals
the
do
reason
close
why
in
I brought
Canada and the U.S., right? But I have a question. Do you think the hospitals like close more in Canada or the U.S.? That happens more commonly?
or specifically in my province, we have hospitals that shut down all the time, mostly in like the outskirts, because
Okay.
we just don't have enough like workers. And if a
hmm
doctor or nurse wants to go take a break, like a day off, there's no one to cover them.
hmm
But at the same time, saying that back in the 1990s, when the economy was doing really good, the local government had an idea to build all these community hubs, like small
hmm
hospitals that you can go to get if you feel sick without going to a
So
big hospital.
so we're
But the
talking
issue
about like the
is,
doctor shortages, how like Canada's having like less doctors, especially in like remote
well, we also
areas like Nova
build too
Scotia.
many. I just believe that we build too many. Like every small community wants their own hub. You know what I mean? Like every small town
hmm
thinks they need like a giant hospital, and that's not realistic.
Okay.
You know what I mean? Like I would think the population, if we want the population to grow,
hmm
right? Like immigrants, more taxes, so you can build more infrastructure. You can't have a hospital everywhere. Is when you think about how big Canada. Like, if you look at Newfoundland, there's so many remote areas that just
I don't
doesn't
mean to be
make
rude,
sense.
but can you give me an argument for why you believe that the Canadian healthcare system is systemically better than the U.S.? Because you're saying that
Uh,
Canada's remote areas, but so does the US, right? You're not really giving a difference or a specific reason why the US would be better than Canada in terms of healthcare.
I think the U.S. is better healthcare if you're rich, because you can pay
But
to see a
what part of the
doctor.
US system do you believe is better than Canada?
Um, I would think it is better than Canada. I think it is in certain ways.
Okay, we agree.
Comparing, like I think like
I agree
if you go
with you,
to
man.
right, but like the problem is, I think you gotta remember the population of California
hmm
is more than all of Canada,
Yeah, you're right.
and
I don't
and
listen. I don't mean to
Americans
be
don't like.
disrespectful to you. I don't mean to be rude, but I do have other guests that are requesting to join the live, and it seems like me and you were kind of coming into an agreement because we both
Yeah,
agree
I just
that
have
Canada is
one
better than
question
the U.S.
though.
I
I
appreciate
just
you
have one
coming up,
question
though.
though.
I appreciate you coming up, though. Okay, and I
Okay.
hope you have a good rest of your day, and I appreciate the
Yeah, you
conversation.
do. Thank you.
All right, let's have the next guest come up. Let's have Guts. Hey, how's it going?
It's going good. What about you?
I'm doing well. Do you disagree with the prompt or have any questions or concerns regarding healthcare?
Um, well, I wouldn't say I disagree. I would say it depends on how you frame it. What does better mean to you?
So there's five main metrics I'm using to determine like what is better, mainly quality of care, access, efficiency, equity, and health outcomes. I believe in terms of like R&D, innovation, like world-class hospitals that the US is better than Canada, but in terms of like access, efficiency, equity, and health outcomes, Canada is better than the US, and that's why the Canadian system is systemically a better healthcare system than the American one.
So the only thing, honestly, that because I live in Canada, but I've also have family in the U.S., so I go in between the two. But the only thing that Canada really has for it is universal healthcare is less expensive for people that are middle class or lower, and the fact that you can't really go bankrupt for any medical issues if you're a citizen, right?
Can I ask you a question? So on screen, I have the metrics. Is there any metric that you disagree with that Canada is better than the US in?
Yeah, access and efficiency, and also health outcomes. That's not true.
Okay.
So it's
So for
true.
access, I'm
Like
defining
oh
access
no.
by like how easily and affordability that people can get medical care when needed. And I'm arguing that the
Hmm.
biggest barrier for Canadians to like receive healthcare and access healthcare is wait times. And the biggest barrier
Yeah.
for the US is the cost of healthcare. And I'm arguing that per capita, more Canadians are actually receiving healthcare and treatment compared to Americans, especially when you consider that 11% is uninsured, 100 million Americans have had medical debt at some point in their life, and 36% of US adults have reported that in the past year they've skipped and postponed getting healthcare they needed due to cost. So that would be my argument.
I'm curious to see the per capita stat. Um, but while
Per
I'm
capita,
I'm
well,
looking for that.
okay. We're talking about one third of
No,
their
I,
population.
I I don't know if you're basing it off numbers or if it's like an assumption you're having.
No, though I'm basing off of numbers. The 100 million Americans and 36% of US adults are from KFF, which is independent and a
Okay.
credible, reputable source. I encourage you to look it up if you would like. What I will say though is this, right? Let's say, are you Canadian or American, if I may, just for like an analogy?
I'm Canadian.
You're Canadian. Okay. Let's pretend that, I'm an American. Okay. My point is that I may wait less than you do if I were to be an American. I would have less wait times and you would have longer wait times being that you're a Canadian, but that doesn't mean that you're not receiving treatment, right? You may get delayed treatment, but you're still receiving treatment at the end of the day, where many Americans skip treatment entirely due to cost, right? Would
Fair
you
enough.
agree?
I looked it up and it's factual. But so you would say it's I can agree then on maybe access depending on how you're framing it.
Hmm.
Efficiency, I wouldn't say it's necessarily more efficient.
That's more like
Canadian
administrative
system is
costs. Like unnecessary. Like efficiency is typically defined by like how well a healthcare system uses its resources to deliver care without waste. So things like administrative costs, unnecessary testing and procedures, preventable hospitalizations, and also like spending per person relative to like health outcomes. So like how efficient is like the US system funded compared to how efficient the Canadian system is funded?
yeah. Have you ever worked within the healthcare system in Canada?
Is that relevant?
I think it is.
Why?
It gives you hands-on experience. Instead of speaking from the paper, you have the practical, like you have the reality. Because you're talking theory here. You're looking at data,
Theory?
and I
Theory
agree with
how?
you. The data,
Data, yes.
yeah. Well, data is paper, right? It's not reality. It's what's said on paper, but
So
it
you don't
doesn't
trust
translate
evidence?
to. Well, I'm
Is
telling you,
that
I've
your way of just
hands-on
saying that you don't
experience.
you don't trust studies?
I've hands-on experience. No, I'm not saying I don't trust studies.
Okay.
I'm saying studies are things that are from the past. Studies aren't predicting the future and they're not looking at the present. They're evaluating metrics based on things that are already in the past. It's not
So
something that
so
is
what do you use to
actively.
predict the future then?
You can use your own observation skills, logic. You
So
can use
people's
plenty
observation
things.
skills, they can predict the future?
I didn't say you can predict the future. I said you can make deductions, which isn't the
Hmm.
same.
Okay.
Do you think you can use logic to understand things, or do you need
Well, for a
studies always to
debate,
just?
part of debating someone on a topic is by applying like logic and evidence to support your reasoning.
Sure. So if I told you an apple falls due to gravity, do I need a study for that, or could you just like do it for yourself and like, oh yeah, he's right, like using your own logic, or do you need a study to back that up?
I would say that studies can help you understand that concept because there's also other variables if you do it yourself,
Yeah,
right? Because it
but
wouldn't
would
be
you agree
true just
studies are
because you
only
do it.
analogies?
Like just because someone
Study,
experiences something, that doesn't make it just true for everybody else.
sure, but that's the caveat. It doesn't make it.
So what are
Doesn't mean
you
it's not
arguing
true.
exactly? Are you arguing that like science is flawed, the
Well, I
studies I'm
wanted to
using
talk
is
about the
flawed, my argument's
efficiency.
flawed?
No, I wanted to talk about the efficiency. So you say it's efficient. Um, do you know how you get an appointment in Canada if you have health issues? Let's say you have
That's not
health
an argument for
concerns.
why you disagree.
Well,
Can you give
I'm
me
I'm
like an
doing the
argument?
experiment with you. Yeah, it's a question for you first. So how do you go consult
Hmm.
if you have health issues and you're concerned? How do you go see a doctor?
That's anecdotal.
It's not anecdotal. I'm
Yeah,
asking
my
you
personal
how.
experiences and asking like what I would do is anecdotal.
No, no, I didn't say how do you personally. I said how does it work in Canada if you have
But
health
what are you trying to
concerns and you
argue?
want to
What is
see a
your
doctor.
argument? You've yet to even present an argument for why you disagree with like
But do you
efficiency
know how? You
specifically.
can just say I don't know how if you don't want to answer the question.
I'm not going to answer your question unless if you first present an argument for why you disagree. So what's the
So
relevance?
you don't want to, you
How's it
don't want to
relevant?
engage with the question. All right. So the reason why I'm presenting this is because you said you look at efficiency and access, but you're only looking at it from, again, a paper theory perspective. You're saying on paper, more Canadian have
Systemically, I'm
access to.
saying.
Yeah, yeah, and I agreed with you, but I said on paper it sounds good, but in practice, meaning reality, that's not how it works. So I'm asking, how does it work practically? And you're saying,
But
well,
how does that
explain
contradict
to
any
me
of
what
the
the
evidence
relevancy
that
of
I
the argument.
provided
So
in the
so now
past?
so now I provided you with my reason why I'm asking the question. So do you want to answer? How do you get to see a doctor in Canada
I
if you
don't
have
need to
health
experience
concerns?
something to know that something exists, right? Like
Oh, okay,
I'm a
but
Canadian, right? I
do
don't
you
need
see
that
that you're
if
not
I
even
may,
answering the question?
but it's not relevant. You've yet to present an
Well,
argument
you're
for
saying
what
it's
your
not
point is.
relevant. How is it not relevant if you don't know how the process works, but you're advocating for its efficiency and its easy access, or not easy access, but
Easy
better
access? No.
access?
More
No,
accessible.
better access. Yeah.
Yeah.
So how is it more accessible?
Because per capita, more Canadians are actually receiving treatment and access to healthcare compared to Americans.
Okay.
Based off of the metrics,
So again,
based off of
what's
what I
the
said with wait
process then?
times, the cost of healthcare, as well as like geographic access and like insurance coverage rates.
So I guess
Like,
even if you
if I
don't want
may,
to
can I
answer
say
that,
something? If I may, like
yeah.
88% of Canadians have a family doctor, right? But at the same time, right, that's not 100%. Many Canadians, especially in rural areas, right, when you look at like the provinces that are like Ontario and like the wealthier provinces that I would argue do a better job with healthcare, you see that's like 90% of Canadians have a family doctor. But if you look at like more rural ones like BC and stuff, sometimes there's only like a 20% chance you get a family doctor. So people in those areas, you can look at that and say that they suffer way more in terms of like accessing healthcare based on geographic access specifically, right, than people in urban ones, right? You can make those claims without experiencing that, right?
It still doesn't necessarily answer my question, but I guess what I'm trying to show you is when you frame something, for example, as your prompt, like Canada healthcare is better than
Yeah.
the U.S. healthcare system, it's not true. The reason it's not true is you're adding a subjective value, better, and you're
Using
pointing it
objective
depending
metrics.
on.
Do you
Well,
realize that a
they're not
debate can
objective.
sound, if I may, do you know that during a debate, a prompt can sound subjective, but if you use objective ways to measure something for the debate, that's credible to do so.
Data can be manipulated. So just
Yeah, and
because you
that's why we
quote
debate
data,
about it, right?
yeah,
That's
but
why it's not
my
like 100%. Like Canada's like the best system, period, right? In all areas.
I understand. What I would say is Canada is better on certain aspects, and for certain people, it's not inherently better than the U.S. healthcare system. Um, the reason why I'm saying that is, and the reason why I was asking to you, how
Spike
do you get
Cupcake, thank you for
access
the
to a
heart. I
doctor?
appreciate the gift. Thank you.
The reason why I was asking you that is, you're saying, well, a lot of people are already, for example, registered under a family doctor. Uh, do you know how crazy long the wait times are when you don't have a family doctor in Canada currently? You can wait months, years.
Yeah, because there's studies that show that. Yeah.
Yeah, and when you want to get an appointment and you don't have a family doctor, and even if you have a family doctor, you have to go through. Well, it works with each province has its own mechanism. I only know about the Quebec one and Ontario because that's what I'm more familiar with.
That's okay.
But I'll give you for example Quebec.
Okay.
If you don't have a family doctor, which I don't know how many people in Quebec don't, but it's like roughly 30%. So when you give the Canadian statistic, it sounds good because you're taking all of Canada, but Quebec has one of the largest population, and it's only 70% approximately that are registered on a family
Yeah,
doctor.
like 1 in 5
One
Canadians don't have a family doctor.
one out of
One out
well,
of
yeah,
five.
one out of five. Yeah, it's more than out of five, but yeah. All
Okay.
those people, when they want to have an appointment with any medical professional, they have to go through what we call like I don't know how to translate it to
Spree, thank
English,
you for
but
the
it's
finger heart. I appreciate that gift. Thank you. Mm-hmm.
so it's basically a system like for people that aren't registered under a family doctor, and you have to go take an appointment online. Anytime you try to go online, there's no appointment available.
Do you mind if I ask you a
You have
question,
clinics.
if I may?
Hold on. You
Okay.
have go ahead. No, go
Well, I was
ahead.
just gonna
Ask me
say
the
that
question.
like it feels like we're so far we're talking about two subjects, right? Access and efficiency. Now, I defined how I define access, and I talked about the biggest access barriers in Canada being wait times, which is what you were just mentioning, and the cost of healthcare, as well as like geographic access, right? Which we've talked about like slightly, and then also like
But I would
insurance
say
coverage
it's not
rates.
only wait
So, do you
times.
think
It's
that
that's
per
my point.
capita? I have a question. Do you think that despite wait times, do you think that per capita more Canadians are receiving treatment and healthcare compared to Americans? Or do you believe the opposite is true? Just so I understand your view.
Per capita, I don't even know, to be honest.
Okay. So you don't agree or
But
disagree?
if I were to make a guess, I would say it's easier to have access in the United States to a doctor or anyone. It's just that it will affect you financially. In Canada, you can't even like
But what makes you say
you
that?
just don't have access.
What
That
makes
and
you
the
say
reason
that?
why what makes me say that is exactly what
Hmm.
I told you. If you don't have a family doctor, the process is completely different from any other person because you have to go online. Online, you have to take an appointment, and you don't have any slots available. And that's why I told you, do you know how it works practically and not only in paper? Because in
Well,
paper
do you
it
know?
sounds good.
Hmm.
Or if you go, because look, I've worked in hospitals during COVID, uh, also after post COVID, and then I left.
Hmm.
When you say people are treated better, or no, the healthcare system is better. Second thing, just because someone is inside the hospital doesn't mean they're having a good healthcare, um, not system, but a good healthcare being provided to them. It doesn't mean they're being treated right. Like I've seen stuff, I'm not gonna disclose it, but just because someone is inside a hospital doesn't mean they're being taken care of appropriately. Like I'll tell you, in Quebec, the
If I
system is
may,
pretty
can I
like
say
set up.
something? If I may,
Yeah, sure.
I don't want to be disrespectful to you when I say this, but it feels like you're not really giving me any argument for why you either disagree or what
Well, I
really your
already
position
explained to you.
is.
You're talking from a theory perspective, and I'm telling you, do you know how it works in practice?
But
And you're
you're
telling
telling
me,
me to
well, what
take
is
certain
the
things into account,
relevancy?
but you've yet to
No,
actually mention a specific like logic or
I gave you
evidence
two
for why you
specifics.
disagree.
I gave you two specifics. I told you you gave us stats about Canada broadly, but if I take Ontario, look, let me go look
But if I may,
Ontario. How many?
like you just said that like some Americans like they're still able to get care, and then you said Canadians can't because of wait times, right? But you're not
It's
actually
not
providing
wait
any
times. It's
logic or
not, look, it's
reasoning.
not wait times. Look, if you cannot get if you cannot get an appointment with a doctor, is that a wait time issue or is it you just don't have access to an appointment? Wait time is you have access but you have to wait a long
Wait
time
times
before the
are
doctor
a
sees you.
barrier for accessibility. It makes it
Yeah,
harder for like for any Canadian that has longer wait times on average. It makes it harder for that Canadian to access the healthcare system because they can get delayed care and they have to wait longer for it.
exactly. And then the doctor sees you, but if let's say you go through the emergency system, what happens
But
then?
do you want to compare it to the
The doc
US or just Canada?
No, I'm telling you in practice, the way it works, you're comparing two different systems and you're saying one is better because one is
Because
no cost
we're
associated.
comparing both
It,
systems,
it's
but you're
it's
only
paid through
talking about
taxes.
Canada. You're not talking about the US. Like 100
Well,
million
I'm
Americans have had medical debt,
well
11% uninsured,
I
and
already acknowledged that.
36%
I
of
said the
adults have skipped
difference.
care due to cost. Do you think
But
that
look, this
healthcare is accessible for the 36% of US adults that in the past 12 months they've skipped care due to cost?
well, I already agreed to that. But my issue here is you're making it. Oh, one is free. It's not. Maybe you have some barrier to accessibility or
That's not my
wait
argument, but
time
okay.
issues. wait time issues, but at least you don't have medical debt. And the other one is, well, would you? Okay, let's say
Are
you
you
have medical
debating
debt,
yourself?
right?
I'm just curious because those are not my
No, I'm.
positions or
Let me
arguments.
ask you
You're
this:
making up
what is
you're
better?
making up
Hold on,
positions
hold
that you
on. Let
think
me
I'm
ask you
making.
this. No, let me ask you this then. The U.S. You agree that the U.S. you have access to a doctor faster than in Canada, but you'll have to pay.
In terms
There's
of
a
wait
cost.
times, yes.
Okay. What is better for you in terms of health? Seeing a doctor 3 months, or a specialist, should I say, a specialist, 3 to 6 months from when you have the issue, or as soon as possible and have debt?
Do you realize that this debate is not about what you would rather do? Right?
No, I'm
If I may,
asking
can you
you,
allow me to answer this
what
question?
is more beneficial to someone's
Can I answer
health?
the question?
Is it finances or is it getting healthcare?
Well, for starters, I already talked to you about Americans that are skipping care, and I can also tell you that there's
That
plenty of
that's
evidence
a
that
separate
suggests
thing.
that Americans also skip care on necessary procedures, not just elective ones. Okay, so that for starters. But also, I'm not arguing what you would rather pick. I'm not arguing that the Canadian healthcare system is better for you and that you would rather have longer wait times but cheaper care versus going to the US for more expensive care or less wait times. That's not the argument. My argument I presented to you about accessibility is that per capita, more Canadians are actually accessing healthcare and treatment than Americans are. You've yet to make any rebuttal on whether or not that is true or not and why you disagree with that.
About what? Sure not.
Per
I'm sorry, I
capita,
misheard.
are more Canadians able to access treatment and healthcare compared to Americans? I'm arguing that yes, right? Do you
Well,
disagree
Canada
with
has
that?
a universal healthcare system. I already acknowledged that. I literally
That's
answered
not
it
what I'm
like from the
asking you. I'm not
get-go.
asking if Canada is universal healthcare. I'm saying are
Well,
Canadians being able to
just
access
by the
care
basis of their
more than
system, there's
Americans
more
are?
people registered. Hold on, hold on. Just by the basis of their system, there's more people registered under it than there would be in the U.S. So obviously,
Okay, so you agree.
like just pure deduction.
So you agree?
Yeah,
Okay.
I think it's a established fact. I literally told you, even though those people are registered, it doesn't mean they're receiving
Mhm.
good health care. And this is why I'm saying when you say it's better, just because you're under the system doesn't mean it's better. It's like again, you're talking paper, and I'm asking you, okay, but in practice, is it actually better? Like when you're inside the system, is it actually better? And you're telling me, well, you're inside the system, it's already good enough. And I'm telling you, no, it's not.
So what are you trying to
And
say?
plenty people agree with that. And this is what I'm trying to tell you is
All
I'm
right.
not saying it's
This is the
good or
last
bad.
concluding thing because I do have other guests that
Sure,
requested to join the live, and it feels like we're agreeing
that's
now.
fine. You can go to the other one, but I just wanted to present it that way, that
Okay.
when you frame it as better, and then you say,
Mhm.
well, maybe not for you, but this is how I look at it. Well, then why put the word better in there if it's subjective? And
Yeah,
you're telling me
because
you're
look,
looking
can I tell you
at
something?
subjective stance.
This is not having to do with like me and this prompt in this debate. This has to do with debating in general, right? I could have the most outlandish prompt ever. I could say that Canada is the best country in the world if I want to, right? And it doesn't matter what it is. What matters is the metrics. What are you basing that off of? And that is where the debate starts. When I just say better, it's defined by those 5 main areas. I'm arguing that because Canada's better in more objective metrics that are typically used to associate how good or bad a healthcare system is than the US, that makes the Canadian system better for the purposes of the debate. That doesn't make it better for you, better for me, right? The Canadian system, I'm not going to like talk about my anecdotes and stuff like that because that is anecdotal, it's irrelevant to the conversation. But I can have terrible experiences with the Canadian system and still think it's better than the US systemically, right? The same way, just because you're in a rural area, you could have bad experiences with healthcare, but still acknowledge that statistically the Canadian system is a better system, right? Both are
Hmm.
true. The same as someone with good experiences, right, in the US system that have good insurance, that get it like from their employer, right? That they never had problems with healthcare with like the US system. And they can still agree that the US system is flawed, right? And is a worse system compared to Canada. Both can be true. Like, I'm not arguing
Fair.
it's better for you. I'm arguing it systemically. And I appreciate you coming up. And I hope you have a good rest of your day.
Yeah, you too, man. Take
All right. Let's have the next guest come up, everyone. Welcome in. Welcome in. I'm gonna try to keep the conversations, unless if there's a guest that actually like wants to debate. I'm gonna try to keep the conversations a bit quicker so we can get through some guests. Olive Oil, welcome. Hey, how's it going?
Hello.
Do you disagree with the prompts or have any questions or concerns regarding healthcare?
I disagree with some of the prompts.
Okay.
I'll admit that yes, I think that on average, Canada's healthcare system is better than the U.S.
No, you're not
healthcare
supposed to
system
agree
when it
with me,
comes to
man. Okay.
when it comes to global, yes. When it comes to per capita or per population, absolutely. Um,
Mm-hmm.
but as you have said, when it comes to certain things, it's absolutely worse.
Okay.
I
It,
was playing
is there
hockey
anything I've
in the
said though that you
WHL.
disagree with though specifically?
Quality of care,
That the U.S.
or
is
not
better than
quality of care,
Canada?
sorry, access. Sorry.
Access? Okay. Well, did you
Access.
hear? Okay,
Yes.
so I define access by like how easily and affordability that people can get medical care when needed. The reason I define it that way is that the biggest barrier for Canadians being able to access healthcare is wait times, and the biggest barrier for Americans being able to access healthcare is the cost of healthcare. So I'm simply arguing that even though Canadians are waiting longer for healthcare, they're still receiving treatment at the end of the day, even though they're waiting longer and getting delayed treatment versus Americans, where 36% of adults have reported that in the past 12 months, they skipped and postponed getting healthcare they needed due to cost, as well as 11 million, or sorry, 100 million Americans having medical debt at some point in their life, and 41% of adults like currently carrying some form of healthcare related debt, as well as 11% of Americans uninsured.
Okay. Yeah. I can see that in some ways. I'll use my personal experience because that's the basis that I have to go off of.
Okay.
I was playing.
We can agree it's anecdotal though, right?
Yes.
Okay.
Yes. I tore my ACL, PCL, MCL, meniscus, and tore my kneecap in half.
Mm-hmm.
My hockey team sent me to the States, and I was given treatment immediately.
Okay.
Last year I was diagnosed with a tumor. And luckily it is benign, but I am waiting currently 2.5 years to see any sort of specialist
In Canada or the U.S.?
in Canada.
Okay. By the way, I will continue this conversation with you a bit further, but I do want to let you know that I have a bunch of guests requesting, so I can't have you on for too long about this.
Yeah, no, that sounds good. I'm currently waiting 2.5 years. I've already been waiting a year.
Okay.
So that'll be 3.5 years concurrently to see a specialist of any kind. The general hospital was able to figure out that it's benign, but I have no recourse. No, I've been told that it can turn cancerous at any moment, and if it does, I have a certain amount of time to live, but I don't know when it might turn cancerous. I'm not being given follow-up appointments. I'm not being given anything like that. And that's absolutely a problem. When it comes to the masses, and I'm sure there's some other people who have had similar outcomes, where they're having life-changing and life-threatening things and having to wait problems, having to wait longer than they might have. And I think
All right.
globally that is a problem. I think that, yeah, sure, in some cases Canada's system is better. I think in some cases the US's system is better. If we're going globally, Sweden or Switzerland. But
I agree. I think that Switzerland's
um,
the best healthcare system in the world, in my opinion. But a lot of people think like Germany, France, and those
yeah,
countries as well. All
I
right.
think that there's a lot of things we need to do better.
All right.
And wait times is one of those things.
Okay. Well, I appreciate you coming up, and I hope you have a good rest of your day. And I appreciate it.
All right, have a good day.
All right. Let's have the next guest come up. We're looking for people that disagree or have any questions or concerns regarding healthcare. Hey, how's it going?
Not too bad. How are you?
I'm good. Do you disagree or have any
Yeah, I
questions
just
regarding
like
healthcare?
I live here in Toronto, right? And I mean, my experience recently with the healthcare
Mm-hmm.
system is like nothing at all what these people are talking about. Just in November, I
Me
was
or people
diagnosed
in
with
the
having a lesion
comments?
on my kidney, and like I
It,
saw a specialist in 3 days.
if
I was
if
operated
I
on
may,
like
if I
within.
may. Okay. Do you disagree or do you have any questions or concerns regarding healthcare?
Well, no, I don't. I haven't disagreed with anything I've heard you say so far.
Okay.
Except I think maybe France is a little bit better than Switzerland, but
Okay.
that's sort of
Not with
minor.
like the prompt.
But like I said, like I was diagnosed with that. I was told that my kidney had to be removed, like within 5 days of me feeling that there was a problem. I was operated on 3 weeks later, and then I was discharged from the hospital 4 days after that, and I feel great.
Okay, now look,
So I don't know
really
what these people are
apologize. I
talking
don't mean to
about.
be rude, but I have like a bunch of people that want to debate specifically on healthcare, and I do
Yeah, go for it,
apologize. I
man. I'm
will have to let
sorry.
you
I
go,
just wanted
but I
to, I just wanted
appreciate
to
it.
throw that comment in there. I apologize. Have a good broadcast.
You too. All right, let's have someone come up. Next guest. We're gonna get through the best I can. Hey, how's it going?
Hey, I'm good. I'm in Manitoba. How are you?
I'm good. Do you disagree with the prompt or have any questions or concerns regarding healthcare?
I do. So thanks for letting me up, number one. Number two,